he will come in.
Okay.
You want us to give them some time? Then we can give, let me say, under 5 minutes.
Another 5 minutes. Okay.
Is it
So,
okay?
phone now,
so,
Huh?
Badura.
Okay.
So, Badura. But we have to figure out what to be talking about.
Zignity, ana m afụ ọbọnte nwa na-azụ gị ebe ahụ, Zignity.
Oh, Jesus Christ of
Oh, yeah,
Nazareth.
I cannot talk about while we wait.
Yes, Abba, but this meeting is being recorded, though.
Dịka n'ezie okwu unu kwesịrị ịdị na-ebido rekọd a na-achọsi ibido ife na ebe ụmụ na the first 10 minutes na eji akọ ọnụ so
Okay,
amala anyị
let's hear the pause before is Abba
John, good evening.
and I'll mute people so that we could go ahead and start. Thank you all for availing your time to be here today. So this is another one of our usual calls where we try to inspire people to live a healthy life with the DOBA 09 set. So we have one of us here, Ozioma, who is going to be taking a lead in the conversation today. And I think there is somebody else who would be joining. So just want to say thank you all for availing your time. I am going to give Ozioma to kind of give us an introduction while I pull up this presentation here.
Lost Fiat. Okay, my name Afambo Madbiko Ziamachi Agozie. Na JSC bụ F. Then SS bụ H. So I studied restorative dentistry in the University of Dental School in Enugu. Then currently I'm studying medical radiology and imaging in the Camelos, Rome. So just like the world of medicine is very wide. It's not something one person can do. So the same thing goes to every part of medicine, radiology, nursing, physiotherapy, and this particular dentistry. So that is why I chose to invite someone on his own field. You understand? So in talking about the oral health, I'm going to talk about the restorative part of the oral health. So while my colleague will talk about the preventive aspect of it. So as you know, there's a saying that said that prevention is better than what? Cure. So it's better you take his own if you have not encountered a dental problem. But while I'm bringing my own, some people might have been having issues already. So I need to tell them on how to keep their oral health. So as we said, we used to say that the oral cavity, the mouth, is the gateway of life. I'm not going to take our time. I just want to make it brief so that it will not be boring. Then, if a question on what in my presentation, you can ask me. So I will make it as simple as possible. So here now, the mouth is the gateway of life. The role of dental restoration in oral hygiene serves several purposes and is significant to health. Dental prostheses include, that dental prosthesis is artificial restoration, includes denture, bridge, crown, and implant. Not only restore function, it doesn't restore function only, it also restore aesthetics, but also oral hygiene, which is our main focus here. The role of dental restoration include to restore the function to restore oral function like chewing and digestion. Dental processes restore the ability to chew food effectively, and proper mastication. Mastication means to chew something. Promote better digestion and reduce food debris accumulation in the oral cavity. If you don't have some teeth or tooth in your, or chewing be difficult for you, and when you chew properly, you have what we call improper digestion in the body, thereby causing you health. Restoration of the oral cavity promotes digestion of food, and when your food is properly digested, that means that your body will absorb the nutrients well, making you to live a healthy life. Missing teeth can impair speech, yes, and properly fitted prosthesis restored phonetics, it restored speech, and the bacterial accumulation from poor speech pattern. For example, like somebody without teeth or tooth, or we find it difficult to control its salivas. And if there is saliva space, there is possibility of accumulation of bacteria in such areas, thereby causing a health issue to the person involved. So, prevention of further oral health issues, like preservation of adjacent teeth. Adjacent teeth missing a space in space. The adjacent teeth, the tooth or teeth that is beside the space. I don't know if I'm making sense, but only confused. The person can call me back by raising a finger. So now, teeth replacement with prosthesis prevent shifting or tilting of adjacent teeth, which can create a hard to clean space where plaque and bacteria accumulate. This means if you have space in your mouth, a dentulous space. A dentulous means a space where there is no teeth, where you lose tooth or teeth. If you have it, over time, the teeth or the tooth tends to tilt towards that place to close those space. By so doing, causing making brushing a kind of difficult for someone, thereby making food debris to accumulate in interdental spaces, which can lead to formation of plaque, which will lead to further tooth decay or losing of other teeth or tooth. Maintenance of jawbone. Fixed prosthesis like implants stimulate the jaw, prevent bone resorption, which can lead to periodontal issues and the stabilization of surrounding teeth. Even meaning that this maintenance of jaw health is like, can you imagine someone that lost one side of the tooth in the jaw? You understand? So thereby making the outlook of the person not to be pleasant, you know, then the resorption can lead to periodontal disease. Periodontal disease means gum disease. Periodontal disease means gum disease. So it can lead to periodontal disease. Reduction of plaque accumulation. A well-designed prosthesis help to eliminate food trap caused by missing tooth or gap. This reduces the area where plaque and calculus can build up, and thereby supporting the oral hygiene. That is, if the denture is well designed, the prosthesis help in eliminating those space that trap food due to the edentullousness of the person or patient. Those space that will trap food, when you restore it with oral prosthesis, it will close up the space, thereby eliminating the trapping of the food debris, which can build up calculus or build up bacteria in the mouth that can lead to deterioration of the teeth, and which can equally affect the health of the individual. So, support for proper oral health hygiene, improve access to cleaning or for cleaning. Properly aligned and restored dentition allow for better brushing and flossing. Fixed prosthesis, example, bridge or implant, maintain arch integrity and reduce irregularities that complicate hygiene. It promotes hygiene of awareness. Patients with prosthesis are often more conscious about maintaining the oral health due to the cost and importance of the appliances. Imagine when they use oral restoration, the person will be so conscious and aware, okay, I'm using this now and I have to keep it clean. It will make you, when you keep it clean, it will even push you to keep your mouth clean too. You understand? By so doing, due to the cost of the denture or cost of the oral restoration, it will make you to be aware. So, coming to aesthetics and psychological impacts, someone that loses his or her teeth, sometimes, or to some people, like most especially women, it makes them to lose confidence to speak. Imagine you want to speak, you don't have teeth in your mouth, you don't have that confidence to face the public. And again, it will deteriorate your beauty. That is what he's trying to say in this aesthetic and psychological impact. Motivation to maintain cleanliness, aesthetic improvement, motivate patients to maintain oral hygiene more diligently. Cleaner prosthesis improve confidence and reduce oral halitosis. Halitosis means mouth odor or bad breath. It is called halitosis. But when you are aware of it, it makes you to clean your denture, clean your mouth, thereby reducing the bad breath or mouth odor, halitosis. So, barrier to hygiene if poorly maintained. Now we've talked about the importance of dental restoration to oral hygiene and to the health. Now we are talking about the effects. The effect, okay, barrier to hygiene if poorly maintained. Why prostheses support hygiene? If not cleaned properly, they can harbor bacteria, fungi, example, candidiasis, and all those. I don't want to bore you with all those these things. Just know that it can harbor things that are not good, bacteria that can affect your health. This can lead to gum disease, infection, and decay of abutment teeth. Decay of abutment teeth is standing teeth. It can lead to more decay and loss of tooth or teeth. Facilitation of regular dental visits. If you have prosthesis, patients with dental prosthesis typically require regular follow-up for adjustment and hygiene maintenance. This routine visit encourages professionals, encourages professional oral care and early detection of issue. Due to the patient is using prosthesis, it will make him to once in a while pay visit to the dental clinic, which will help to dictate if there's any discrepancies in health or oral health of the person in time. Not like you'll take it, but it may go for a very long time due to visits, dental visit or health visit as frequent as you're supposed to. I dictate things late because one thing I observe here, let me even leave this aspect of what I'm saying. One thing to observe about cancer, because I've been opportune to be in the oncology unit. Cancer is early detection of cancer, you have almost 95 to 90% to 95 chances of curing the cancer when it's being detected early. But when it's detected late, chances of survival most times is like 10 to 15%, which is very, very low. So the same thing applies to these dental cases. If you visit dental clinic frequently or as required, there will be early detection in oral problems. You understand? So in summary, it replaces missing teeth, prevent food trap, improve chewing, which will help in digestion, support jaw and tissues, prevent bone loss and gum disease, aesthetic restoration, increase patient motivation to clean regularly, maintain arch structure, reduces abnormal gap and clean challenges, encourages dental visit and promotes early detection of hygiene. So now, this is what this thing look like. Now you can hear. This is what a dentulous mouth look like. Imagine someone without it like this. Yes, it happens. People have it. It can be due to poor oral hygiene, cancer, accidents, diabetes. And if my colleague come now, he will explain to you how you have the risk of having diabetes. Yes, you have the risk of having diabetes if you have poor oral health and hypertension. Okay, I think I will throw a little light on it. Now, chronic inflammation of the mouth. Chronic inflammation of the mouth can release what we call cytokines. Cytokines are chemical messengers that interfere with insulin ability to move sugars. You understand? So when there is inflammation in the body, from the blood, the cell, that is example, there will be insulin resistance, which will cause diabetes. I don't know if I'm making sense, but after when you have no question, can ask me. So poor oral hygiene can cause diabetes. It can resist the production of insulin, which will lead to insulin resistance, which can cause diabetes. Then again, it can cause the inflammation, which can cause oxidative stress in the blood, which will make this thing blood vessel to narrow and stiffen. The heart will pump harder, which will lead to what? The BP, increasing the pressure of the blood. So if the efficacy of maintaining good oral health, it will take you away from the troubles of disease like diabetes, high blood pressure, and others. Now, this is example of a patient named Moro Eze. Now again, for those people that are using denture, because maybe some of us, they use artificial teeth, we don't know, or we might know, or some will space, no have, but they didn't see the need to replace the teeth. But for those that already have denture or prosthesis, for those that have it, the best way to maintain it is you soak it overnight in a clean solution. The clean solution is water. You see, the clean solution is water. You soak it overnight. So if as you can see now, it's not pleasant looking at someone without teeth or that have dental issues, because if you see someone to the first thing in because you understand. So the maintenance of the denture, you wash with hard brush. You don't sleep with the denture. You soak it in a clean water overnight. Then you will hard brush the denture. That is how is done. So if anybody have this is an example of a denture. This is called full denture. This one replaces the full, the upper and the lower abutment teeth. This is for a patient that didn't have any teeth in his or her mouth. So, example. Okay. John, can go to back. Back. Again. Yes. If now, this is a poor oral hygiene by this patient. Now, this is called plaque, dental plaque, as you can see. And in the gums are inflamed. All these things are not working now. This thing can induce stress on the patient. It can stiffen, it can make induce oxidative stress in the blood vessel, which will lead to narrow and stiffen the heart. When it stiffens the heart, now it can cause BP. So you look at it, it's not pleasant in looking. So I think I'm done. So when you have a question, you can put it up based on what my colleague, I will alert him to come inside then to take over.
Is Leonard here now?
Let me write him.
Okay. All right. So we have a question from Agoziem. He's asking, how do you remove dental plaque?
Okay, I'm coming. I want to alert Leonard.
Okay.
Give me a minute.
Sure.
Okay.
Sure. I think while you are alerting him, I want to chime in a little bit. You kind of said some things that that really got my attention, especially how some of the food that we fail to chew very well and everything, or how just poor dental hygiene can lead to high blood pressure, and also some high blood pressure and some cardiovascular diseases, right? Can you throw more light on that? I kind of find it very interesting. How does poor hygiene lead to high blood sugar and some cardiovascular diseases?
Okay. Now, when you have a poor oral hygiene, which will lead to formation of plaque. All those formation of plaque is the action of candidas, fungi, and bacteria in the mouth. And the bacteria and all those things, they thrive more in they thrive more with sugar, glucose. You understand? For example, mgbe anyị na-achọ onwe ya na-akpọ kemi ya na-akpọzi ya okay, anyị bịa na anyị na-eme oncology in treatment of cancer. Onwe ya na-akpọ some of the body parts they receive nuclear ihe na anyị na-esend. So ebe anyị na-eji etinye ya ka o receive bụ na the cancer site, and that cancer site contains glucose, because when there is so much glucose, and then rapid growth of microorganisms, even cancers, then when glucose and when sugar, they are very, very viable. You understand? So relating that to mouth now, when there is inflammation, when there is this reaction, it releases what we call cytokines. Man, cytokines, for example, like cytokines, chemical messengers. You understand? that interferes with insulin ability to move sugar. The inflammation in the mouth, like this thing now, this picture, dental plaque inflammation, inflammation here now. Before you know, they are working with sugars. Next thing is to go and inhibit those chemicals, that chemical messenger that builds insulin, ability to move insulin sugars, that moves insulin sugars. Once more inhibit, that means there will be no production of insulin. There will not be supply of insulin in the blood, causing insulin resistance, which can cause diabetes. And diabetes is about lack of insulin. It take the diabetic now. Insulin kind of buy her. Man, in a situation whereby this inflammation causes the release of cytokines, John, I'm make sense to you.
I think I'm getting it. So,
Yeah.
so what I'm hearing is that, so when somebody chews food, right? If there are inflammation, there is a release of, is it hormone called cytokines, right?
Yes, that is in a chronic inflammation.
Okay.
Over time, not like the inflammation will go, but over time.
Okay.
Poor oral hygiene over time, which can lead to chronic inflammation.
Okay. So once
And
the
then
inflammation comes, so when the inflammation
then
comes, the person cannot chew food very well, right?
that time, that is when you will be having toothache, inflammation, all those kind of things. So imagine, for example, even diabetes na their family, because someone didn't na lineage. Imagine you small thing now, it will build up. Then coming to BP, and we are oxidative stress. When you give, it causes oxidative stress. There's the blood vessel. Okay. It causes of oxidative stress in the blood vessel. When there is inflammation, not only in the aspect of cytokines, when it causes those stress in the blood vessel, it can lead to narrowing and the stiffening of the heart to pump. When it leads to the narrowing and the stiffening of the heart, it will make the blood to the heart to pump blood harder, leading to increase of blood pressure.
Okay.
If I make sense here.
Yeah. I'm able to connect the dots, and which is very interesting. I think your fellow just joined.
Yeah,
Leonard just joined.
Leo. Yes, I can hear you. Can you hear me? Yeah. I'm not their question. Just you be online. 10 minutes. I will round up. Then you can.
Ozoma, he can go so that we can ask all the questions together, if that is okay.
Okay. I think I have something to say again.
All right,
sorry.
Go ahead.
Because quiz or something like this. Dental stomatitis is also inflammation of the dental area, the area covered by denture due to poor oral hygiene. It can lead to dental stomatitis. You understand? It can cause the overgrowth of fungus, candidas. That is, sometimes we call it oral thrush. You understand? Due to it can be caused due to when the denture is being worn for a very long time, and again when the denture is poorly maintained, it can lead to dental stomatitis. So I will allow Leo to come in and give his own lecture. Then we can entertain all the questions that comes.
Yes, thank you.
Should I send you his slide?
Yes, if Leo, can you share your screen, or do you want me to share?
You can share. You can go ahead and share.
Okay, I don't have the slides with me.
Let me send the slide to you.
Okay.
Leo, the last one is send them. Can get send? Yes, the last one, the PowerPoint. Okay. Let me send it.
Leo, if you can go ahead, maybe introduce yourself while we get the PowerPoints all ready and working. Thank you.
Good evening.
Good evening.
Good evening, DOBA. My name is Leonard.
Okay, I've sent it, John.
Can you hear me?
Yeah, go ahead, sir.
I'm a clinical dental therapist. Can you hear me?
Yeah. I can hear you. Go ahead.
So I'm happy to be in your midst. I don't know this of DOBA. So I'm here to deliver a lecture titled the topic titled the oral hygiene practice as it regards to the health improvement. Oral hygiene practice as it regards to health improvement. First of all, if you're talking about oral hygiene, we need to understand that oral hygiene is basically talking about the mouth. It's talking about the mouth and its surrounding tissues. So basically, in a nutshell, oral hygiene is the practice of keeping the mouth clean and free from diseases by regular brushing and flossing. The practice itself refers to the daily habit and routine people follow to keep the mouth clean, gum, tongue, and keep the mouth clean, tongue clean and healthy. So this practice helps to prevent problems like tooth decay, which we call cavities, gum diseases, bad breath, and support the overall health. So oral hygiene is very, very important when you are talking about the act of keeping the mouth clean. So when we talk about oral, people only think that we are only talking about the teeth, but it entails the mouth, the lips, the gum, and all the surrounding tissues, which include the cheeks, the palate, the uvulars. We have so many other oral tissues, which I'm going to analyze in my next slide. So we are talking about the importance of oral hygiene practice. It has so many oral hygiene. Please, can you go back, please? Go back. Go back. So the importance of oral hygiene. Yes. We have the importance of oral hygiene. Importance of oral hygiene. Which we talk about, it prevents tooth decay, gum diseases, support the overall health, that is the heart, prevent diabetes, etc. So it improves self-confidence and free from fresh breath, that is prevents mouth odor or halitosis. So these are the key importance of keeping our mouth clean. We call it oral hygiene practice, as the act of keeping the mouth clean. So when we keep our mouth clean, it prevents our mouth from having tooth decay, gum infection as listed above. So let's go back to the second subtopic. We have the anatomy of the oral cavities, which I included earlier. We have the teeth, the gum, the tongue, the salivary gland. When I talk about salivary gland, I'm talking about the major salivary gland in the mouth, which include the parotid gland. We have the sublingual and the submandibular gland, plus other little glands that helps to nourish the mouth. So when the mouth is not actually healthy, it actually affects all these oral tissue we can see on our screen, like the uvula, the tongue side, the lips, the tongue. Every oral tissue will be affected when the oral hygiene, when an individual is not actually practicing good oral hygiene. So next slide. So daily oral hygiene practices include brushing the teeth. Brushing twice daily. When it comes to brushing, an individual needs to brush twice daily. Not only brushing, but you have to brush using fluoride toothpaste and brush with an even bristles. And when it comes to brushing, we have basically two forms of brushing in terms of bristles. We have the soft, we have the hard, and we have the medium. But basically, as an adult who doesn't smoke, is not entitled to use soft brush or hard brush or even extra hard. The soft brush are used by children below the age of 7. Then the medium brush is used by adults. While the hard brush are used by smokers. Then chain smokers use what we call the extra hard toothbrush. Then basically again, we need to talk about the replacement of our toothbrush, because some people, you have in our midst in Nigeria, as a Nigerian, most people don't usually replace their toothbrush. But normally it's supposed to replace a toothbrush every 4 to 3 months, or when it's after suffering from debilitating illness. Then another one, the second oral hygiene practice includes flossing. So we need to develop the habit of flossing after eating instead of using toothpick, because when we use toothpick, it actually harms what we call the interdental patella. So those gum below between the two teeth, we call them the interdental patella, or the interdental gum or interdental patellas. So another one is mouthwash. We should develop the habit of using mouthwash when we brush, especially the liquid one, we call it chlorhexidine, or the Soto mouthwash. We have so many of them. So we can put them inside our water, dilute it, because most of them are highly corrosive. So they will not bond the gum tissue. The next one is tongue cleaning. So most people don't usually brush their tongue, but after brushing, some people still complain that they still have this bad breath, call it mouth odor halitosis. But how do we solve this particular problem? When you finish your brushing, you need to equally scrape your tongue, because at the dorsum of the tongue, we have what we call the plaques that hang on the tongue. So that when we talk, people say that our mouth are smelly. So we need to develop the habit of equally brushing the tongue after brushing the teeth. So next slide. So additional practices we should keep, they include balanced diet. We need to be taking balanced diet, but diet that is very rich in all the food nutrients at the barest minimum and at the minimum that is required by the body. So more so, when you're talking about a balanced diet, we also need not to be taking too much of sugary food. Even when we attempt to take them, we should endeavor to equally brush up. Avoid those refined sugar hanging on the teeth, because when they accumulate on the tooth surface, they attract or harbor bacteria, because normally there are so many bacteria in the mouth. Most of them are actually very healthy. But when the environment is not favorable for them, they start causing havoc. Or when the experience of refined sugar in the mouth, they harbor on those refined sugar. At the essence of trying to feed from those refined sugar, as they are breaking the refined sugar down, they will be releasing an acid, which we call the lactic acid. The lactic acid will start demineralizing the tooth surface. Over time, the person will just wake up one day and find out that he or she has what we call cavity, or we call it tooth decay. I don't know whether I'm making sense. Am I still on the line?
Yeah, we can hear you.
All right. So another one is talking about the hydration. We need to take plenty waters, because when we take plenty waters, the bacterial environment that usually spoils food, which lead to gum infection or tooth decay, the environment will be destabilized, and equally help to actually convey a proper digestion of food in the body. Another one is a regular dental visit. Most people don't usually know that it's good to visit a dentist every 6 months, but people usually visit their dentist when they have excruciating pain that warrant removing the tooth instead of restoring or conserving the tooth. So it's very, very important that we do visit the dentist for checkup, because they say that prevention is better than cure, and we spend less money preventing the tooth. And I assure you, as I speak, if any of you started earlier, If anybody started earlier to visit a dentist, the person do the proper thing, the cleaning every 6 months, and I assure you, until the person leave this planet, the person will never develop any dental issue in terms of gum bleeding, gum infection, mouth odor, tooth decay. Because I believe the problem we have in Nigeria and Africa as a whole is poor awareness, lack of awareness, and poor education. So I believe in this platform, after today's workshop, every 6 months is mandated for every and each individual to go and visit their dentist for routine dental checkup and cleaning. The next one is tobacco and alcohol intake. So we need to reduce the intake of alcohol because they actually may lead to cancer. Not only cancer, cancer can happen anywhere, even in the other cavities. Because other cavities has connections with every of the organs in the body, including the heart, including the liver, so including the eyes. So mostly anything that happens to the oral cavities can actually trigger and affect the other organs, vital organs. Because there's a connection, there's a blood supply from the heart that supplies and passes through the coronary artery and supplies to the head and neck, and some of them still supply to the teeth. So which means that it's possible for someone to suffer from diabetes due to the accumulation of refined sugar in the oral cavity. So there's a connection between the mouth and the heart, between the mouth and the liver, between the mouth and the lung. So we need to take proper care of the oral cavity. Please, next slide. Poor oral hygiene this time around. So let's talk about poor oral hygiene. What is poor oral hygiene? We say that poor oral hygiene refers to the behavior and habit that neglect proper care of the mouth, teeth, gum. So this can lead to the serious dental and general health problem over time. So poor oral hygiene simply means when you're not taking good proper care of the mouth by avoiding those things I mentioned earlier. You're not brushing, you're not seeing a dentist, you're not doing this, that usually affect the mouth, the gum, and the surrounding tissues. So what are the causes of oral hygiene? I mentioned number one, inadequate brushing and flossing. So when you brush, or when you don't even brush, when you can't inadequate brush, you have not brushing teeth twice in a day. Some people brush once in a day, which is very bad. Some don't even brush at all. Some brush when necessary. Another one is keeping flossing to plaque build up between the teeth. That is, you skip up plaque. That is those white substance on the tooth surface that usually accumulate on the teeth about 6 minutes after brushing. Another one we call it the next one under inadequate brushing. Say using improper brushing techniques or one-hour toothbrushing. So most times some people don't have the habit of changing their toothbrushes. Most times when you look at some of the toothbrushes that people use these days, you can see that they are bristles. That is, those brush parts have scattered, and those bristles can actually cause danger to the gum. It can cause danger to the teeth itself. It can even make the tooth and the supporting structure not to be properly stick together. Before you know, the patient can lose the teeth. So using improper brushing techniques and one-hour brush is very dangerous. So, but the best method of brushing we recommend to everyone is what we call the sweeping method. Sweeping method is the best method of brushing. So when you sweep, you put the toothbrushing between the gum and the teeth. You sweep downward if you are brushing the upper part, as if you are sweeping downwards. But most people are not aware, but what people basically use is what we call the horizontal method and the vertical method, which actually harm the tooth or the gum. The next one, let's go to the next slide, please. The second cause of oral hygiene.
I wish there was a way for you to kind of show us, because I mean everything you just explained right now, I'm just kind of imagining it, is it more like going up and down? Is that what you mean by the I don't
He will show it.
Okay.
Maybe after Leo.
I'll show you.
Leo,
Okay.
Can you switch to
Yes.
video and show how to brush, please, properly,
Okay.
please? Thank you.
Can you see me? Can you see me?
Yes, we can see you.
Okay. So if you want to brush, you place your toothbrush this way and sweep from up to down for the upper part. For the lower part, you sweep from down to up.
Okay.
Yes, down to up this way. But make sure it covers the bridge to cover at least 3 teeth at a go. 3 teeth at a go. Then you make about 8 strokes. Just 8 strokes is enough. 1, 2, 3, 4, 5, 6, 7, 8. You go to the next 3 teeth. That is 3 teeth. The bridge should cover 3 teeth.
Okay.
3 teeth. Yes. And your brushing should not take you more than 2 minutes to brushing. It shouldn't take you more than 2 minutes. It's enough.
Okay.
All right.
Thank you.
Okay.
Leo. Leo. Leo, in on mute. Leo, in on mute. Which are this? We are
Okay.
in on mute.
I'll put that
Okay.
on mute. We can hear you now, Leo. Go ahead.
Hello.
Yeah, go ahead. We can hear you, Leo. Go ahead.
Can you hear me?
Yeah, we can hear you. I cannot hear you now, Leo. Is he speaking? Ozema, can you unmute yourself?
Leo.
Okay.
Leo.
I can hear you now.
Okay, go
We
ahead.
can't
We
hear
can
you.
hear you.
Okay, it's all right. So
Go
the
ahead.
next, okay, the second cause of oral hygiene is poor diet. So high sugar intake, like sweet soda, processed snack, as I said earlier, they can actually trigger the presence of bacteria that actually causes this damage on the tooth and on the gum. So when they cause this damage on the tooth, they lead to what we call dental caries. That is a tooth decay. But when they cause damage on the gum, they cause gum infection, which can either be classified into 3. We have 4 basic types of gum infection. The first one, we call it gingivitis. That is when it affects only the gum alone. That is inflammation of the gum. But the second one, we call it periodontitis. It's when the gum infection is not only affecting the gum now, but when the inflammation has extended to the teeth and its supporting structure. Can you hear me?
Yeah, I can hear you.
Yes. When the inflammation is now extending to the teeth and its supporting structure, which include teeth 1, gum 2, cementum 3, the alveolar bone 4. So these are the basic supporting structure of the teeth, of which the inflammation exceeds the first infection, which is gingivitis. It will now extend to what we call periodontitis. So the third gum infection, we call it stomatitis, just like my colleague earlier said. It's just the inflammation around the mouth, whether the cheek, the lips. So the inflammation that occur around the mouth is what we call stomatitis, which can be caused by virus, herpes simplex virus. It can equally be caused by wound, eating hot food, can actually cause inflammation around the mouth, the cheek, the lips, the palate, either soft or hard palates. So when it comes to poor diet again, we're talking about acid food and drink eroding and enamels. The teeth has 3 layers: the enamel, the dentin, and the pulp. So when you eat or drink acidic foods like the carbonated drinks like Pepsi or Coca-Cola, the acid in them, the carbonated property in them usually corrode the enamel. And once the enamel is corroded, the dentin will be exposed. And the individual will start developing what we call tooth sensitivity. Tooth sensitivity. That is shock when the person drink cold water or even ordinary air or even acidic fruit like orange, they'll start having shock. The next one under poor diet is what we call lack of nutrients like calcium and vitamin D. So when we know the importance of this vitamin as one of what we call the fast soluble vitamin, ADEK, vitamin A, D, E, K. So vitamin D is very, very important. I think we usually call it cholecalciferol. So they are very important in strengthening of the teeth and the bone. So once the vitamin D is not sufficient in our diet, they weaken the teeth and the gum. Very important. So number 3 cause of poor oral hygiene, we call it a bacterial and plague buildup. So oral bacteria naturally form plague, so which if not removed hardens to tartars. So I can see the picture of, there's a picture of what's, go to the next slide. There's a picture of tartar I want to show you, so you understand what I mean by tartars. No, the next slide. Next slide. There's another picture. Yes, you can see the accumulation, those white substance. No. Go back. Go back. Please go back. Yes. So this is the picture of the tartar. So when plaque build up, accumulate over time, they form this hard substance which we call the tartar. So plaque develop the tartar, those white substance that you see on the tooth surface when you wake up in the morning, early in the morning, before you brush, you call them plaque. So as you fail to clean the mouth, it develops to this hard substance we call the tartars. So let's go back to our normal slide. So the third, okay, we have the third one is bacterial and plaque buildup, as I've explained. So it can even lead to tooth decay, as I said. The number 4, the fourth cause of oral hygiene is smoking and tobacco use of tobacco. So it reduces saliva flow and weakens the immune system. So once anybody smokes, they usually reduces the salivary flow. It prevents saliva from coming out from the salivary gland, as I mentioned. We have the parotid gland, the sublingual gland, which is under the tongue, and submandibular gland. So and once saliva is being reduced in the mouth, they can make bacteria to build up very fast, and it makes your mouth to smell because there's nothing to nourish the mouth. So anybody that's having sticky saliva usually develop what we call halitosis, which is bad breath, very easily. So we should know that smoking and tobacco use is very, very dangerous to the oral cavity. So they can equally increase the risk of gum disease, as I said, tooth loss and oral cancers. So they can usually cause oral cancers like papilloma, lymphoma, adenoma. So these are some of the cancers that can easily seen around the oral cavity and the surrounding structure of the mouth. So next slide. The next one is neglecting dental checkups. Very important. So when we neglect dental checkups, it's not a good thing. So when we book to see a dentist, And the dentist say we should come for a visit or every 6 months. We should go because it's very important for you to detect some early, assess early disease and infections, so they will not be able to go beyond restoration. The number 6 says lack of awareness or education. So thank God for this platform. At least from today, most of us will be able to return to our knowledge that it's very important to take good care of our oral cavity. So not understanding the importance of oral hygiene is very, very bad. Believe that dental care is only necessary when there is pain is a bad notion. Because most people come to clinic when they have pain. Instead of them coming for preventing purpose, they are coming for restorative purpose or for us to be able to remove the teeth. I will still collect money and they spend much money in doing so. So number 7 says medical condition and medication. So there are so many medications that actually affect the oral cavities. So they usually cause what we call xerostomia, which is dry mouth, and make our mouths to become so acidic in nature. So they change the pH, the acidity of the oral environment. But normally, the pH of our oral environment is around between 6.4 to 7.1. 6.4 to 7.1. So that's normal range for the pH of the oral cavity. So once it goes above this or below this, it makes the oral condition, it makes the bacteria in the oral cavity, those normal flora, those normal bacteria that live in the mouth that doesn't harm us, they become so harmful and they start causing decay or harm. So lack of awareness is very, very bad. The next one is number 8, says financial or accessibility barrier. That is inability to afford dental care or supplies. So this one, actually, we blame it on our government because had it been our government inculcates oral care as one of the elements of primary health care in every health center, most of our people in the village that doesn't have money to actually enroll in NHIA programs in order to minimize their treatment plan cost. I think it will play a long way in bringing awareness and taking them to the rural facilities where people need them most. So most people don't have money to actually take care of themselves. And some people have money, but they only spend it when it comes to pain, but they cannot spend the money on preventing purposes. So let's go to the next slide. Living in area with limited access to dental professionals. So that is very bad, where there is no dental clinic, where there is no dentist. But I think these days we train, even when it comes to what we call the community health extension workers, we call it the CHOOS, that are those people that are limited to primary health care centers. Their curriculum equally covers dental care. So we train them basically on the basic knowledge when it comes to dental care, so that when they see any issue that concerns that any case of dental care, they should be able to refer the case to secondary facilities, that is to the cities and to the federal medical centers and the teaching hospitals for proper management. Number 9 says mental health and lifestyle factors. So depression and anxiety may reduce motivation for self-care. Substance abuse can accelerate dental decay. So these are some of the things, some of the mental health and lifestyle factors that usually affect the oral cavity because it's a poor oral hygiene. So it's very, 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 very important we should know about this. So the next slide, please. So let's go to the effect of poor oral hygiene practice. So look at the picture here. It signifies what poor oral hygiene has done to this particular oral, to this particular tooth, to the teeth in this particular patient. So the first effect, we call it so the first effect of oral, we say dental caries. So when we don't take care of our mouth, as I said earlier, it will lead to tooth decay. So dental caries usually occur when there is deposit of glucose, those refined sugars in the mouth, and the individual fails to brush the teeth. Bacteria will accumulate on those refined sugar. And as the bacteria is trying to feed from those refined sugar, they are breaking those refined sugar down and they are releasing acid in that process. So the tooth material they are breaking down includes the enamel, which is the first layer of the tooth. After the enamel, they will break down the dentine, which is the second layer of the tooth. And they will break down the top, which is the third layer of the tooth. So these three layers, if they are broken down by bacteria during this decay, the bacteria, the tooth will become affected and the patient will start feeling pain. The patient will start feeling pain. So if you look at this structure of these three samples I listed here, you can look at those the last picture. You can see the damage of bacteria on that tooth. So let's go to the next slide, please. The second effect of oral hygiene is sugar. It encourages plaque formation. That is the dental plaque formation, as I earlier explained. So plaque is the buildup of biofilms, those refined sugar in the mouth. That is, they usually develop immediately after brushing. So it is very important that we brush two times in a day. In the morning, after taking our breakfast, and at night, before going to sleep, which means you must have finished eating. Then you now brush and go and sleep. So that when you wake up the next day, there will be no plaque accumulation on the surface of the teeth. So let's go to the next slide. Number 3 says, the next slide, please. Increase the risk of gum infection. As I earlier explained, I have explained those gum infections. I explained gingivitis, periodontitis, but the last one is what I have not said anything about. This is we call it the pericoronitis. So pericoronitis occur when there is inflammation of the gum around the last molar. Inflammation of the gum around the last molar. So when you have inflammation around your last molar alone, we call it a pericoronitis. That usually comes with excruciating pain and bleeding. So next slide, please. Number 4 says, reduce salivary flow and pH. I think I've said something about this pH. So once there is acidity in the mouth, they usually affect the pH, that is the oral environment. Because normally, there's something we call the pH, what is the potential hydrogen. It usually shows, indicates the level of acidity or the level of alkalinity in every environment, not only oral environment. So, but I said earlier that the pH of oral environment is between 6.4 to 7.1. Then, number 5 says, contribute to oral dysbiosis. So, dysbiosis simply means when there is no balance. When the mouth loses its balance, that is frequent sugar consumption shifts or upset the natural balance of the mouth. Normally, there is a natural balance in the mouth, even at the anus. Even for women, when it comes to their genital areas, like we don't actually advise women to use hot water to dodge. There's something we call dodging when they want to treat infection. So what we advise them to do is to pour hot water inside bucket and sit on those hot water, because if they dodge and use towel and hot water to dodge their genital area, they're going to disorganize the environment of those normal and natural bacteria that stays in their private area, that actually contributes a lot. They actually play some vital roles in that area. So even in the mouth, we have some natural bacteria that are in the mouth that they play a role in food digestion. They play a role in so many things. So, but when the pH is when there's this biosis, it actually affects those bacteria and they will start misbehaving. Number 6 says, increase the risk of tooth sensitivity, as I've said before. So when we don't take good care of our mouth, there is higher risk of tooth sensitivity, which is shock in a layman's language. That when I drink cold water, I feel shock. The person will be feeling shock. Even when you don't drink water, when ordinary air blows on the teeth, you will be feeling shock due to the exposure of the dentin, which is the second layer of the tooth. Another one is that can lead to this tooth sensitivity is taking acidic food like a carbonated drink, orange that contains citric acid, etc. Number 7 says tooth loss. So poor oral hygiene can lead to tooth loss. You can lose your teeth even without having tooth decay. Because when you don't keep your mouth clean, the accumulation of those plaque and the tartar around the teeth, they can make the gum that is helping to hold the teeth together to separate from the teeth. Before you know, the teeth will start shaking. Over time, the teeth can easily fall off on their own. The next one, number 8, says bad breath. Bad breath is very, very important. I think we should pay more attention to this. Most time when people talk to you, even as clean as they are, some of them are elites in the church, elites in the bank, people that we respected so much, but when they talk close to us, we don't even have the alibi. We don't even know how to talk to them to inform them that their mouth is smelling. So that bad breath is mouth odor. Mouth odor can actually be caused by many things. We have what we call the genuine mouth odor. We call it a genuine halitosis. We have the one we call a halitophobia. Halitophobia is due to fear. Phobia means fear. Fear that you are going to suffer from halitosis when you don't even have halitosis. The other one, we call it a pseudo-halitosis. Pseudo-halitosis means false halitosis. Like for the first one, I call genuine halitosis. That is the real halitosis we have. That one is due to the decay of food in the mouth after consuming food and you did not brush, or after taking some spicy food and you did not brush. When those people talk close to you, you'll be perceiving this bad breath. So that one is genuine. But pseudo-halitosis is false halitosis. The patient will come to your clinic and make you to believe that he or she has this halitosis. But after examination, you will find out that the patient does not have halitosis. So how do you solve this problem? You don't actually tell the patient to go. But because it's a psychological problem, the psychologist is already telling that they have halitosis, why they don't have. You need to do something for them. So that one is pseudo-halitosis. I think when this one when you come to the clinic, I'm going to give you more lecture on this. So I think I'm going to end here for now when it comes to halitosis. Then the next one is infection and abscesses. That is, abscesses are just accumulation or formation of accumulation of pus in an area, a localized collection of pus in an area. This is abscess. So infection and abscess. So poor oral hygiene can cause infection. It can equally cause abscess formation, especially when we don't brush our teeth very well. Number 10 says increase in risk of systemic issues like heart disease, diabetes, complication of respiratory infection. So when we don't clean our mouths, we are risking ourselves from suffering from these basic health problems. Some of these health problems are usually seen among geriatric patients, those elderly patients between 65 and above. So because there's a connection between the mouth and the heart. There's a connection between the mouth and the liver. There's a connection between the mouth and the circulatory system. But remember that when we talk about diabetes is just the presence of accumulation of sugar in the blood. So when we take refined sugar and they circulate in the blood, so they cannot, those refined sugar as they are flowing from the blood because the teeth has a blood supply to it through the pulp. So when the connection from the pulp to the heart is going back because any blood that flows to the teeth need to return to the heart again. We call it a pulmonary circulation and systemic circulation. They move from the heart to the teeth through systemic circulation, carrying oxygenated blood. They now move from the teeth again and return back to the heart through what we call pulmonary circulation. that is carrying deoxygenated blood, which will now take some of those blood back and connect them. They will release their carbon dioxide through the lungs. And when we breathe out oxygen, we will now release carbon dioxide through our nose and our mouth. So have you seen there's a connection between the lung, the heart, the liver, and everything? So we need to take good care of our mouth. The next one, let's go to the next slide, please. Oral habits to avoid. Number one, not brushing or flossing regularly. Please, you should avoid it. Brushing too hard. When we brush, we should not brush too hard. We should know the right toothbrush to use. As someone that doesn't smoke, as an adult that doesn't smoke, the best toothbrush for us to use is medium toothbrush. Please don't use soft. Soft will not remove any tartar, it will not remove any plaque. But if you are a smoker, use hard toothbrush. If you are a chain smoker, you are advised to use extra hard toothbrush. Are we good?
Yeah.
So brushing too hard can actually cause what we call tooth sensitivity, and it can equally lead to what we call gum recession. The gum will recede from the tooth, because I told you earlier that the gum support the tooth as one of the supporting structures. So when you are not brushing correctly, you receive the gum or causes a tooth sensitivity by causing abrasion, cervical abrasion. It abrades the enamel, remove the enamel, and exposes the dentine. So number 3 says skipping dental checkup. Please let us not skip dental checkup, as I said earlier. Number 4 says using your teeth as a tool is very, very bad. So like some of our boys, our men in society, when they go for burial or anything or wedding, when you give them drink, like beer, they say, don't worry, they will use their teeth to open for everybody. So on that course, you can actually crack off your teeth, and one of the tooth crack into 2. It's always very difficult to say, let us restore the tooth. The best option for any dentist is to extract the tooth. And you spend more money extracting the tooth. And after extracting the tooth, you need to replace the tooth. If not, it can lead to malocclusion. That is poor arrangement of the teeth in the mouth over time. Then number 5 says chewing on hard objects. So when we chew on hard objects, it's not actually good, like pencil, pen, our fingernails. It can actually fracture the teeth. That it can damage, like, you understand, damage the crown or damage the filling, especially some patients that already had filling on their tooth. So it's not good to chew those things. They are not good. Number 5 is what we call grinding or blanching. But basically, they will call them the blue system medically. So you can see some people, especially our age parents, when they are gnashing their teeth to making noise. So there will be friction between to making noise. I don't know whether we've seen such a scenario. People will be grinding their teeth together for no just cause. So by so doing, they are developing friction between the upper teeth and the lower teeth. Before you know it, the enamel will be chipped off and the dentine will be exposed. The teeth will be very smooth, but normally the tooth surface is not supposed to be very smooth, because it is designed in a way that it can be able to perform its function of chewing, grinding, tearing, and biting. These are the basic functions of the teeth: chewing, grinding, tearing, and biting. The biting is for the incisors. The tearing is for the canine, and the chewing and grinding is for the premolars and the molars. The premolars and the molars, they are the one that perform the function of the grinding and chewing. Then the next one is causes tooth wear, jaw pain, and even tooth fracture. So when we don't take care of magic, like using tooth as bottle opener, as tools to tear pure water, tear everything, tear this, tear that. So they can actually cause great damage. Number 7 says smoking or chewing tobacco, which is very bad. So let's go to the next slide. So smoking can actually lead to halitosis, bad breath. Number 8 says frequent snacking or sugary food. I think this one is basically attributed to female counterparts that usually like chocolate a lot. So chewing those things can make the mouth to actually harbor a lot of refined sugar, which can attract bacterial infection. The next, number 9 says thumb sucking. So when you are sucking your tongue sucking, you can actually push out the front teeth. Before you know it, the individual will develop what we call malocclusion. Like those people that when they close their mouth, their teeth will still be open. Their teeth will still dish out from between the lips. So we call it malocclusion. And we spend a lot of money to correct that bite. Like formerly, I think if you watch football a lot, we should know that there's a particular footballer is wearing an appliance we call braces. His name is Lamine Yamal. Are you with me?
Yeah.
Lamine Yamal. So he's putting on braces to correct his bite. And if you remember a lot, again, there's another footballer called Ronaldinho. Ronaldinho, if you check Ronaldinho's teeth before, his teeth was pushing out, but I think now he has been correcting it with braces appliance, which the cheapest price to correct it here in Nigeria right now is around 1,000,000, So number 10 says improper use of whitening products. Right now, as we speak, there are a lot of whitening products going on internet. They say buy this, do it yourself, do that, but the only one that is very recommended is the one that the dentist directed to do, because it's not all whitening products that are healthy for the teeth. So some whitening products, after using them, they are going to cause great damage on the tooth materials, the materials of the tooth now, which we call I think the name, actually, I don't want to go deep. We call it hydroxyapatite crystals of the tooth material itself. It will make the tooth to become very porous that anything that the individual eats, it stains the teeth. So we should be very careful when we are using some tooth whitening products. The next one is tongue thrusting. So some individuals that suck their tongue can actually causes a malocclusion on them. So next slide, please. Next slide. So these are the common source of refined sugar we have today. Like if you look at those things, pizza, all those plantain, cake, chocolate, ice with Coke or Pepsi. So these are the commonest place we can source our refined sugar. So next slide. Next slide. So prevention, how do you prevent poor oral hygiene? Limit intake of sugary food and drink, especially between meals. Brush twice daily and make sure you use fluoride toothpaste. Like if you are using any paste that is not fluoride toothpaste, know that it's not recommended by the Nigerian Dental Association. So any toothpaste you are using in Nigeria, make sure that it is being recommended by the Nigerian Dental Association and Nigerian Dental Association. So, but as dentists, we don't recommend toothpaste for patients. But make sure you use made in Nigerian toothpaste. Made in Nigerian toothpaste, very important. Because every toothpaste has ingredients that it contains. Like example, we have the detergent and it has its composition, it has a percentage. You have sweetener inside toothpaste. We have humectant. Humectant makes the toothpaste to bind together. We call it half binder. We have a flavoring agent. We have abrasive agent. That abrasive agent is what makes the toothpaste to actually remove dirt on the surface of the teeth. But the problem we have in our country today is that people buy things without asking questions. So we advise you, if you want to choose your toothpaste, please don't buy powder toothpaste. It's very, very bad. Don't use powder toothpaste because they contain what we call high abrasive agents. As if you are using vim to wash the back of your pot. So they usually causes abrasion. Before you know it, they will expose your dentine. You'll be having shock all the time. Another one is when you want to buy your paste, any paste that you are using is making your saliva to become sticky. Please change your toothpaste, even if it's made in Nigerian toothpaste. Now another thing, and let's go on to prevention. Brush twice with fluoride toothpaste, floss daily using dental floss, regular dental checkup and cleaning, drink water as I said earlier, use sugar-free gum to stimulate saliva. I think I have to actually exercise more on this. Chewing gum is not actually bad, but we recommend some special gums like the Obits. We call it sugarless gum because they don't usually have a more plenty of refined sugars. So, but when you chew gum, they actually stimulate salivary flow. They make your saliva to flow freely, and they don't give in room for bacteria to carry out their havoc. Are you with me?
Yeah.
Yeah.
Okay. Okay. Let's go to the next slide, please. Okay, oral care routines. So these are the basic oral care routines that we must keep every day of our life. They are very simple and effective oral care routines to keep your teeth, your gum, your mouth healthy. Healthy, very important. Because when you're talking about oral care, people usually neglect this oral care a lot, but they don't know that anything that happens to the mouth, because since the mouth is the gateway to the general body, if anything happens to the mouth, the other part of the body, they are in great danger. Like when I was serving in Nigeria, I remember during my service here, we have a patient that suffer from what we call it lupus erythematosus and angular cheilitis, which result of the inflammation of the along the neck region. But this thing was caused by simple problem. The individual noticed the early sign of the tooth decay, but they neglected the early sign. They were busy taking herbs, dogoyaro, mixed with other herbs, thinking that it's going to solve their problem. But when the problem persists, it results to this lupus erythematosus and angular cheilitis. They had to run to the clinic. By the time they came, we cannot be able to save the patient. We actually carried out a surgery on the patient, but the patient later died. So we should not neglect our oral care. So this routine care must be kept every day of our life. Number one, brush your teeth twice. I think I'm hammering this for the fourth time. Twice, at least use 2 minutes is enough. Brush, make about 8 strokes. Make sure that the braces of your toothbrush cover at least 3 teeth at a go. Make 8 strokes, I repeat, 8 strokes in a particular place. You go to the next 3 teeth. At least 2 minutes enough for you to finish your brushing. Then lastly, you scrape your tongue. Very important. Then when you are brushing, use fluoride paste. Use fluoride paste and bristle, whether soft, medium, or hard brush, depending on your lifestyle. So make sure that your paste is fluoridated. Because according to WHO, World Health Organization, they say that every of our drinkable water should contain about 1 part per million. That is, if you are bringing 1 million drop of water, that you should drop 1 drop of fluoride in your water. That is the reason why most of our water are fluoridated or chlorinated. That is, they must be treated with chlorine or fluorine. So fluoride paste is more recommended because fluorine is very, very vital to the tooth surface. So another thing is that we should brush all the surfaces of the teeth, whether the back, the front, the chewing surface, that place we used to chew, especially at the premolars and the molars. Remember I told you that the premolars and molars are used for chewing and grinding. Are you with me?
Yeah.
For chewing and grinding. So the next one said when you floss every tooth to remove play, because when we are flossing, floss are used. I believe this is we are in a conventional society of which we travel every day. We go to good eateries. We must have seen floss with handle. So when we put the tray between 2 teeth, we draw it out. As you're drawing the floss out, it is removing some debris that our toothbrush cannot remove, that is hanging between 2 teeth. So this is the importance of flossing, to remove those debris between 2 teeth that our brush cannot remove. Very important. Another one is Gently glide the floss under the gum line and curve it around each tooth. This one is entitled for a kind of floss that doesn't have handle. There's a kind of floss that you fold around your fingers and put inside the mouth to remove food debris. Number 3 says mouthwash. As I think I've hammered on this before, but it's optional. But it's good that you can put it, buy it. I have mentioned about 2 mouthwash we can get in the market. We have a Soto mouthwash. We have a chlorhexidine mouthwash, very important. But make sure when you are using it, make sure it's well diluted. You don't just use it raw because it's corrosive. It's corrosive. It can actually burn the mouth, which will lead to what we call inflammation of the mouth and the surrounding structure. Are you with me?
Yeah.
Yeah.
Okay. Okay, the next one is when you are rinsing with the mouthwash, you are rinsing to remove those bacteria that are dangerous. Those dangerous bacteria. I think I need to mention at least one of them. One of those dangerous bacteria that usually cause, I think we call it lactobacteria acidophilus. I think the name is long. Lactobacteria acidophilus. So this is the bacteria, the pathogen that usually causes this tooth decay, and they equally cause this gum inflammation when there's accumulation of dental flake around the mouth. So brush your tongue, as I said, especially the dorsum of the tongue. Brush it everywhere, because if you look at the surface of the tongue, you see that the tongue has some coating, look like towel. So when we brush those plates off to avoid mouth odor and halitosis. So it will equally freshen our breath. So next slide, please. Okay, rinse your mouth with water after eating, though, very important. So we don't just drink water. So there's a difference between drinking water and rinsing your mouth. When you drink, you just pour inside the mouth and swallow. But when you eat, you rinse out. So if there's any food particles between the teeth, should be flushed out. You gargle very well. Number 5 says chew sugar-free gum, as I said, at least for 20 minutes. Very important. So chewing gum is good, but sugarless gum. The chewing gum that doesn't contain refined sugar. I think I mentioned one of it. Call it the obit. I think obit is generally known. Number 6 says replace your toothbrush every 3 months, as I said, or after illness. So it's needed to be replaced. So we don't use our toothbrush forever. 7 says visit your dentist every 6 months for professional cleaning and checkup. Very important. Drink plenty water, especially after meal. So let's go to the next slide, which is I think is conclusion. Next slide. Okay, I think conclusion is basically we're going to emphasize on everything I've actually talked about today. Starting from our mouth. Our mouth is very, very important. The mouth, the teeth, the gum. So we ought to take good care of our mouth to avoid all these harmful effects it has on human beings. Like starting from bleeding gum, we call it gingivitis, inflammation of the whole mouth, whether the tongue, whether the palate, whether the cheek, we call it stomatitis, inflammation of the teeth and its surrounding structures, we call it the periodontitis. Inflammation of that happens around the last molar, especially when the gum is covering the last molar, because if you remember, this last molar is the last tooth to erupt in the mouth. They usually erupt within the age of 21, 19, 20, 22, 23. 19, you understand? So when the teeth is coming out, it's usually because the gum around it is already keratinized. So when they are trying to push, you see that most times those individuals, they usually suffer from fever, some of them suffer a great pain because of the hardness of the gum. So when the teeth eventually come out, the flap of gum, part of the flap of gum will still be covering part of the tooth. And when the individual eats, the food substance will be hanging under the gum that is covering the tooth. And when the person brush, the person cannot be able to use his brush to brush off those debris below the gum. Before you know it, they will develop inflammation. Even even without touching it or normal touching the gum, you see that the blood will start coming out around that area. So we call it pericoronitis, inflammation that happens only around the wisdom teeth. That is the last molar. I think at this juncture, I need to stop here to entertain your questions.
Wow, wow, wow. Luna, thank you very much. This is very, very mind opening. And also, Ziaman, thank you so much. So, we are going to use the next 13 minutes to ask questions. So, if you have a question, please go ahead, raise up your hand. Only people that raise up their hand, those are the people I'm going to call. And some other people that dropped their question in the comment section, those are the ones I'm going to read. So please, if you have a question, raise up your hand right now so that we can utilize our time very well. So the first question would be from Agoziem. How do you remove dental plaques?
Leo,
But if you want to remove, okay. Hello,
Go
come
ahead.
on.
can you hear me?
Go ahead, Leo.
If you want to remove dental plaques, you brush early in the morning after your breakfast. Plaque are those biofilms that accumulate when you wake up in the morning. You brush very early in the morning after your breakfast. Immediately after your breakfast, you brush. Don't brush before your breakfast. Then the next time you're going to brush is at night. After your dinner, you brush again and go and sleep. Then another way to remove it is you visit your dentist every 6 months. So when you come to the clinic, we are going to use our machine to do what we call general cleaning. In that general cleaning, any place that is very difficult to remove, we are going to remove all of them. And I assure you, if you are doing that frequently, you will never develop gum infection, tooth decay, mouth odor. I assure you, just make sure you visit any dental clinic close by. Thank you.
So plagues are different from the sugar that is left on the tooth, right? And results to decay. Plagues are those bacteria that are formed overnight as we sleep and wake up, right?
Yes,
Yeah, I
those
think
white substances.
The white substance.
Those
Okay.
yeah.
white substance are dental plaque that accumulate on the teeth. But dental plaque, as I said, if they're left untreated, if they are not removed properly, they can calcify. If they calcify, they now form another deposit we call the status, or we call them the calculus.
Okay. Okay. All right. So I've never heard about this is my first time hearing that you brush after eating breakfast. I usually brush before breakfast all every day of my life. This is like my first time.
So if you are going to do it, I think first thing you should do is that you just early in the morning, use ordinary water and wash your mouth. Use clean
Okay.
water, just rinse out before you eat. After eating, you now brush and go to work.
Okay.
Anyway,
No,
it's the same
that's
thing over here because
yeah.
if I after eating I used to go and brush. So the moment I have my flatmates will be like, "Man, you are crazy. Why
Mm-hmm.
will you eat after eating? You brush then in the morning. But if you must brush, if you must eat before brushing, that means you brushed in the night. The last thing you did before sleeping was brushing.
Mm.
If you
Interesting.
must do that, that means at night before you nap, but the last thing you would do is to brush. Then when you wake up in the morning, you can eat. Then when you wake up in the morning, you put on with milk, then eat. And after eating, you can brush.
Okay. Thank you. So another question is what type of toothpaste the toothpaste that have fluoride in it, which ones do you recommend for people that are in Nigeria? And why is fluoride so important? Like, why is it important that every toothpaste must have fluoride in it?
Okay. First of all, let me start for the last question. Fluoride is important in every paste, even in our diets. They help to protect the bone.
The
They help to
bones.
protect, yes, they help to protect the teeth. So any bone or teeth that doesn't contain fluoride or calcium becomes very weak. It can easily be attacked by bacteria. Then more so, one of the reasons why I forgotten the first question. First question says what?
The name of the toothpaste.
Any toothpaste that you
Okay.
recommend? Yeah.
Okay. Right now, no dentist can recommend any toothpaste for you, but this is how we recommend paste. Because we don't advertise for any company. We don't advertise for Close-Up or Pepsodent. So we don't advertise for them. They're not paying us. But make sure that you use any made in Nigerian toothpaste. If you're in Nigeria, use made in Nigerian toothpaste. That is recommended by Nigeria Dental Association. And when you are making your choice of toothpaste, don't use a powder toothpaste one. Don't use any paste that when you are brushing, it look as if you are feeling like sand at the surface of the teeth. So don't use it because those ones contain high abrasive agents. Another way to make your choice of your toothpaste is that even if your wife is using Close-Up and you're using Sensodyne, even if you are a couple, you must not use the same toothpaste. You can be using Sensodyne and the Sensodyne is making to feel like vomiting. Please don't stop using Sensodyne. Look for another toothpaste and use. Or even the Sensodyne is making your saliva to become sticky. Please change toothpaste. Look for another one. Another made Nigeria toothpaste and use.
Okay. So we have
And
Mr.
again,
Yeah, go ahead.
and
Go ahead.
again, I think ị ga-afụkwa ya na-arụ the toothpaste a ga-ede chlorinated a na-ede ya na-arụ ya. So ị na-anya ọfụma na-arụ the toothpaste ị ga-afụ chlorinated or NDA, that is powered and supported by NDA, approved by NDA, Nigeria Dental Association. So once the Nigeria Dental Association have approved it, that means it's chlorinated, that they have satisfied it. You understand?
Ke maka ndị na-ejikwenu osisi wee na-atatu, because that was what we saw our mom and dad do then. What do you have to say about that?
Yes, that one is very important too. I think it's very important question. I think remember we have other cleaning agents that we can use, but you know those ones they are becoming a cake to us. Like in the olden days some people use salt and charcoal, which is equally very good. Even in medicine, there's something we call activated charcoals. Activated charcoals are used to treat poison, especially when you have something like overdose of paracetamol. They can recommend activated charcoals for you. So charcoal and salt is equally very useful. Another one is chewing stick. It's very important because though most of the chewing stick we use are medicinal, they don't only remove plaque and tatters. They equally help to remove bacteria, bactericidal or bacteriostatic. They stop the action of bacterial growth or the key bacteria don't have bacteria that actually causes a tooth decay. So most of the chewing stick we have in Nigeria, I think most of them that are medicinal we have the Calabar chewing stick. We have I don't know whether you know about Calabar chewing stick. We have another one from Yoruba land. We call it the Pako Pupa. Pako Pupa. We have another one we call Uriata. Uriata. We have another one we call Pako Dudu and Meniro. So these are the basic ones that are highly medicinal. So they don't only remove death, but they are medicinal. They help to kill the bacteria or they stop the bacterial growth in the mouth. So you can be using your toothbrush and paste and augment it. Maybe after brush, you can put your chewing stick in the mouth and be winding it from time to time. It's very important. It's very good if you can be able to practice that. Thank you.
Okay. So we are going to speed it up a little bit. Miracle, do you want to go ahead with your question?
Yes.
We can hear you. Go ahead. Yeah.
Everybody. the speakers. Thank you for a wonderful session. Really enjoyed it. And I have some striking things for those who are I think I've tackled one of some of them. I've had some of them. And we focus
Your
our
voice
eyes
is
focus in primary
your
school.
voice is not very clear. We can't hear you very well.
Can
It's a little bit
you hear me now?
keep
Can you hear me
speaking.
now?
Yeah, it's better.
Yeah.
Our auntie taught us in primary school and secondary school that you have to brush your mouth before eating. So coming in here now, you have taught us a different thing that we have to brush after eating. Now I'm being settled. Then the second question is, we kind of, then we are all adults here. This thing about giving head, like you said, and then that thing has this side effect on our oral hygiene. Like you said, like guys, now that
Oral
is
sex.
you guys
Oral
are
sex.
yes, it's a fellow, monkey, it's a fellow. That will have a side effect on our oral hygiene. That's my question. Thank you.
Okay. Can I come in?
Yeah, go ahead, sir.
No?
Yeah, Leonard, go ahead.
Oral sex good for oral hygiene. Yeah?
Yeah, so that's his question. Can you guys hear me? Hello?
Okay, I can hear you.
Yeah, go ahead.
I didn't get his question. I didn't get his question.
So he the first one he stated was about while growing up we've always been taught that we brush our teeth and then we eat, so perhaps he wants you to throw more light. Then the second question was about how does oral sex affect dental hygiene?
Okay.
I didn't get the
Let me
first
start from
question.
the.
Okay, you get it
Okay,
right.
let me.
Leo,
Yes.
go on.
Yeah. The second question says oral sex affecting oral hygiene. Because if you are having during oral sex, it is remember I told you about something we call disorienting, or this when there is no balance in the oral environment, it can actually cause great damage when there is shift in the pH of the oral environment. So during oral sex, there are some bacteria you are introducing to the mouth that is making the mouth to become unhealthy. There are some bacteria that are not supposed to be in the mouth. There are some bacteria that are not supposed to be in your stomach. Like right now in the stomach, there's something we call the H. pylori in your stomach. This H. pylori equally plays a role in digestion of food. So when it comes to the mouth, you have some bacteria in the mouth. So introducing another bacteria in the mouth will actually make the oral environment not to be balanced and actually cause havoc. I don't know what I'm understanding me.
Yeah.
Because I said normally you have normal flora. Normal flora is every part of the body. Even at the large intestine, we have normal flora there. They live there. They exhibit what we call symbiotic relationship. That's a relationship between individuals. Like normally, if you are my friend, we have three types of symbiotic relationship. If you are my friend, and if we want to cook rice, you bring beans, I will bring rice. You bring oil, I will bring water. So we are bringing everything equally. So that kind of relationship, we call it a mutual relationship. The second part of a symbiotic relationship, we call it a parasitism. So this one is the one that is very bad when you introduce oral sex. When you do indulge in oral sex, you are introducing an imbalanced environment, which you are going to introduce what we call parasite in the mouth. So that parasite now in that relationship simply means when you bring rice, you bring beans, you bring water, I will sit down. When you finish cooking, I will still eat your food. At some point, you start depreciating. Before you know it, you cannot be able to provide money for you to cook again. So that kind of relationship, we call it parasitic relationship. But the third relationship, we call it commensalism. It's a situation whereby you bring your rice and oil and beans and cook, and you cook every day, year in, year out, and you are not complaining, you are not affected. and I will be eating your food. So that kind of relationship, we call it commensalism because the host is not affected. So as you're indulging in process, you're actually introducing bacteria that is going to make the oral environment to be balanced, and it can actually cause so many other diseases, even other cancers, even infection. Then the first question says, talk about, they say they used to tell us to brush after, brush before eating. So that was olden days anthem. So when you brush after eating, assuming you brush and want to go to work, assuming you pick milk, please let me check. Can I change my mic?
Yeah, go ahead.
Okay. While we are waiting for Leo, can you hear me?
Yeah, go ahead, Ozim.
While we are waiting for Leo, I think talking about the Nka na achieve so that Kai cut to everything echafo. Is imagine when you brush your teeth, then maybe in the morning after eating you brush your teeth and go out. When you talk, you give out fresh breath, right? But imagine when you eat something like a proteinous food na a pungent smell, like you eat you take milk or beans. Then after that you go to work. Maybe you brush your teeth before that, but you all know maybe in the next 2 hours, only kind of order on a bring out. So it is best advised that you eat, then brush. Then last thing you do in the night after eating, you brush. That means you brush your teeth, then you sleep, you wake up in the morning, your teeth, your oral cavity is still fresh and nice. Then you eat.
Yeah.
Then before you go out, you brush. Understand?
I think how you guys, I think how you both explained it makes a lot of sense to me, right? You know, because you want to be fresh, you want to come out fresh, you want to come out confident, and when you're speaking, there is no halitosis here and there. So I think we'll leave that question there. So everybody would implement it as they seem fit, but Achom Kaiwape also said that we could do our game. Nzube, are you ready for your question? So Enyokwa, God's will be the last person. We're no longer accepting any new question. But Nzube, as you unmute yourself, Leonard, are you here?
I'm here with you.
Okay. So as
Leo,
Nzube
we'll
is
make it
getting
short,
ready,
please. We'll make the answer short.
yeah, we'll make it short. As Nzube is getting ready, how does, you know, we spoke about the oral sex and everything. How does kissing affects like oral health? You spoke about introduction of new bacteria and how that can affect the pH level of the mouth and all that. How does kissing affect oral health?
Okay, it affects both negatively and positively. So when you are kissing, it actually stimulates blood flow around the mouth. That is the positive aspect. But if you are kissing the wrong mouth, a mouth that has halitosis and has a plaque accumulation, you actually sucking and interchanging saliva that is not healthy, thereby infecting the oral cavity or the general system of your colleague. So basically, even when you go to a canteen, you're not supposed to drink from cup in a canteen because if the saliva of the person that used the cup is infected, you're actually going to carry contact infection, especially waterborne infections. Thank you.
All right, J Kings, are you ready with your question? Muzube is not here. Is that Eza Mama? Yeah, go ahead.
Yeah, it is Mama. My question is that I don't really get what you said about inflammation and types of inflammation. Like, I think he made mention of 4 types of inflammation. So, and I didn't get it very well. So only the last one, the one you talk about the um is it the last teeth inflammation or something like that? The others, I don't even get what you said about it very clear.
Okay, let me speed up. Hello.
Yes, sir.
Hello,
Go
John.
ahead.
Come on.
Sorry, I didn't know when you guys called me, but I overheard it because I just went to pick something. Sorry,
Okay,
I want
hang
to ask
on.
my question.
Hang on, hang on. Let him finish, then we can bring you up.
Okay.
Yeah, go ahead. Go ahead, Leonard.
Okay. The inflammation is just tissue damage, tissue response to infection, your tissue response to accident, your tissue response to injury. Like if you are using fork to eat and you damage your gum, it's an inflammation. Do you understand? But the inflammation that is caused by poor oral hygiene around your gum, that is affecting only your gum will be bleeding. You'll be seeing blood around the teeth and the gum. We call it a gingivitis. Gingivitis. Then the second inflammation is when you neglect to treat gingivitis, the inflammation will now progress and affect not only your gum now, but your teeth and all the supporting structure of the teeth. That one we call it a periodontitis. Are you getting me? And the last inflammation, you say you got the last one, which is a pericoronitis, the one around the last molar. The other inflammation we call it stomatitis. This inflammation happens in your mouth, entire mouth, whether the gum, whether the palate, whether the cheek, whether especially when you eat hot food. If you eat hot food and the thing burn your palate, it burn your mouth, it's an inflammation, but we call it stomatitis. Are you with me?
Yeah.
Yes.
Thank you.
Okay.
So,
Let me chip in in our waste
yeah,
time.
yeah, go
That's
ahead.
stomatitis because you might experience it in the quiz. That's stomatitis again for poorly maintained denture. For poorly maintained denture, it can lead to stomatitis too. You get? We can go ahead.
So,
Okay.
so are you saying that, Abona, if I have a cut on my skin, right, and then the tissues, they respond by,
Bleeding.
they respond by bleeding and forming blood clots so that there wouldn't be much bleeding. Is that thing inflammation? Is that what you call inflammation?
It will increase, like it will swell
Inflammation.
up.
Mm-hmm.
Yes.
Okay.
Inflammation
Okay, go on.
inflammation can happen anywhere in the body.
Mm-hmm.
So inflammation simply means tissue response. The way your tissue responds to all this I mentioned, accident,
Okay.
on infection. So that infection is on the gum. That's why we call it gingivitis, gum infection.
Okay.
Anywhere you have cut, even when they use knife, when you are cutting your ugu, you use knife and cut your finger. It is an inflammation and blood is coming out. That is the way your skin, your tissue respond to that cut through bleeding, through pain. So it is an inflammation. So we have two types of inflammation, basically, generally. We have acute inflammation and we have chronic inflammation.
Chronic.
Acute inflammation are those inflammation that does not last long. At least 1 week is enough for you to heal. And even without taking any medication, it will heal on its own.
Mm-hmm.
But chronic inflammation is inflammation that lasts for a very long time. So any chronic condition lasts for a very long time. So I think that is it about inflammation.
Thank you very much. Nzube, are you ready now?
All right. My question is a quick one. Thank you, everyone. There is a when you are doing this presentation, you said about alcohol. I want to know how alcohol, because alcohol varies. Is it beer alcohol? Because normally any starch food is an alcohol when it's being fermented. Any starchy food in marinade, or chifu, or because of fermented. Then my second question is first question is how does alcohol affect oral hygiene and what type of alcohol? Is it a beer or all these normal food I need? Then secondly, this flux in an efu. Or you watch as a go body too much. Oh, do you I am a final. Or you watch as a call. Let's just throw a little bit more light around the flux.
Okay.
Thank you
Let
very
me start from the floss. Floss,
much. Yeah.
on a been in a canteen, you will need toothpick. Akuya?
Yeah.
Man, no, they big again, you want to have a nacha white. At times, when you call different color nacha, and it's Yanese. I don't know whether you've seen it before.
Nebu, Nadi Nebu, on this special,
Correct.
but Manokwa to speak.
Yes. I am with dental floss.
Oh, yeah, with dental floss.
Okay.
All the very important. If after brush you use it, then for the alcohol we are talking about, alcohol affects. Well, everybody take alcohol almost every day because most of the food we eat, they use alcohol to preserve it. But the one we are talking about is too much intake of alcohol. Like you take alcohol even when you drink beer. But when you even talk about even the biscuit that you eat, they use alcohol to preserve it. So they say
Yeah,
that
that's
even
what
the Bible says
I
much of everything is bad.
yeah.
So when you take too much of alcohol, even in category so that halitosis. Thank you.
All right. Thank you. Thank you very much.
Yeah, Unzube,
Okay.
this is Flux. I just went to go bring it for you.
Thank
Nice
you.
one.
Emma, na side what to speak guy now. Okay, so don't worry. I have to give a flux. I have not just go no
And,
flux.
and again, toothpick is not good.
Yeah, toothpick is not good.
It's not good for the oral cavity. So if you can avoid it, avoid it.
All right. Before we get to Enyokwa, in toothpaste there are green, red, black markers on toothpaste. I was told that green markers is healthier than the black ones. Kindly throw more light to it.
Okay, let me just make it short. The color of toothpaste doesn't matter. You understand? As we said before, use a chlorinated or fluorinated toothpaste approved by Nigeria Dental Association.
Great.
Okay. Yeah.
Enyokwa, go ahead.
Yeah, uru chioma ndị be anyị ekelekwa m ya.
Dalo.
Daalụ. Akwụ na ihe m na-ekwu ọfụma.
Yeah.
All right. Enwere m three questions which I draw. That toothpaste unu na-ekwu maka because ịmago na Nigeria obodo anyị asago ụfọdụ adịghị ejezi ebe ezigbo toothpaste. Nọ ihe ọbụla afọ hụrụ taa atụ. Na-ajụ Agnes Nwamma powdered one ọ dị mma for the eze a na-eji ata atụ. Because ọnya ọbịa na mfe ụfọdụ na-eyuzuzi now. That Agnes Nwamma, that powdered something.
I understand.
Then another one bụrụ nwatakịrị a mụrụ ọfụ na-epu eze. Amarọ m na ọ dị right isi n'ala puo eze lapụ nke elu. Because o nwere nke mfụ onye ezi ya dụrụ na o bido n'ala ube eze. Onwe ihe dị wrong with the child. Then the third one bụrụ my friend ọ ya bụ okwu always is ọ na-atakwa atụ every time mụ na ya na-ekwu okwu na-enotis na ọnwa ọdọsi ya n'ọnụ apụta mara m the problem ama ya mma afịa ọta atụ ọfụma ama m na ọ adị ọcha but okwu ebe a tii na na-esi isi tinye nọ nchi eji mana mmadụ azaghị ihe gbasara toothpick because ebe ekwu nkịta na that one egosiri m that ọmarụlọ m alụ ama m ka esi eyuze ịgwara ike bụ eziokwu that toothpick that
Flux.
Flux.
Yes. Ịgwa ike amarọ m eyuzie enwere m ya n'ụlọ anyị maazị ka esi eyuzie ya okwu ntinye ihe a n'etiti eze ọtakịrị ama m ka m ga-esi mee.
Okay.
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 Let me start.
Okay. Come on.
n'ọnụ ma use it. So achọrọ m ịstọp ya.
ọ bụrụ na a na-epu eze sayensị gwara anyị na ọ bụrụ na a na-epu eze a na-enwe age range eze ji apụta mmadụ n'ọnụ. Eze na-apụtakarị nwatakịrị n'ọnụ between the age of 6 to 8 months. That is eze na-ebu ụzọ apụta bụ eze ana 6 to 8. Ọ bụ na eze ana na-abụ apụta ịbụ apụta ọzọ ga-apụta ga-abụ nke enu pụta nke na ọzọ apụta. But ihe nwe ya na-akpọ variation na eze ịpụta. O nwere ike nke a na-eburu nke enu ụzọ pụta, nwere ike nke enu eburu nke a na ụzọ pụta. So ọ dịrọ wrong.
All right.
Agnes Nwamma bụ Nwamma onweghị onye na-emebi biznes ya. But toothpaste ọbụla dị na powder anyị achọrọ ya, ọ dịrọ mma because o nwere ihe a na-akpọ abrasive agent, ihe adị ka eji asa azụ ite. So ọ bụ na ọ dị too much n'eze na-ata eze all the time, o mee gị ị na-enwe nwa mmiri jiri oyi na-enwe shock, ọ na-agbanwe gị eze. So ya mere na ya na-eme advice ka a na-eyi dress mama whatever. So anyị na-eme the business mmadụ.
All right.
Then onye eze ya na-echi bụ maka ọ bụrụ ọcha ọ bụ na eze ya na-echichi o nidiri ịbịa ịfụ a dentist, ọ bịa n'ụlọ ọgwụ o nwere machine a ga-eji sachaa ya ọnụ, asachaa ya ọnụ eze ya ahụ akwụsị isi. Then ọ bụ na eze ahụ bụ psychological problem amarụ, ọ bụ na systemic problem anyị ga-amakwa. So ọ irute nso anyị amarụ ka o si ihe mere o ji esiri isi. Thank you, sir.
Ebe clinic gị dị, Leonard?
Okay, my clinic is in Cross River. Ana m eme operation na Cross River, na-emekwa operation n'Enugu. So right now I'm in Enugu for cover up, and I have some clinic I used to cover up in Enugu. Then my clinic is in Cross River State.
Okay, biko ọ bụ na ị ga-enyenwu oziọma adreesị gị just in case any of our people ya chọọ ka ha reach out to you,
Okay.
That would be great.
Ọ depend ọ bụ na n'Enugu ọ ga-abịa n'ihe clinic ọ ga-abịa n'Enugu. Ọ bụ ebe I'll just give him the address. Thank you.
Okay. All right, guys. It's now time for before we go over to the question. I think Leonard, there is a follow-up question about the oral sex. Are you advising against it or just taking caution before engaging in oral sex?
We are not advising against it, but what we are saying is that because the Bible says there is time for everything. There is time for everything. So if you are doing the right thing at the wrong time, you are wrong. If you are doing the wrong thing at the right time, you are right. So there is time for everything. So if you get to I think I believe by now anybody that is married is entitled. You can carry out oral sex. There's no problem. But what we are talking about is that you do the one that is very healthy. Like make sure that your partner is clean, you yourself is clean. Because normally, on a normal sense, kissing is very, very advisable medically. Kissing is advisable medically because the moment two partners are kissing, they are stimulating blood. They make blood to stimulate, and it makes the partner to become happier and active. So for people that they are eligible to at that particular point in time. So I think thank you.
All right. Thank you so much. All right. I am going to share the screen so that people can get ready for the game. While we get ready for it. So please do scan this. Actually, let me copy it. Let me copy it in the link and post here so that everybody can have access to the link. So this is the link to the game here. I'll also post it in our WhatsApp chat for other people to DOBA. Okay. So please start Start logging in. Start logging into the game. So this is the final section of our um lectures today. I think me myself, I've learned so much. I don't know about you guys. I've learned one or two things to really implement. That this is the reason why sometimes it is very good to have like refresher sections like this where somebody who is very knowledgeable like Ozioma and Leonard will come and refreshing our minds on how to properly take care. To be honest with you, I actually was in the dentist's shop like last year for some work, and that thing cost me close to it cost me close to about $3,000. That's like maybe one point something million or 2 point something million. And that's
Hey,
the reason why. That's the reason
John, please share the link. Have you shared the link?
I've shared the link to this chat and also to the DOBA chat.
What's
And
up,
that's
bro?
the reason why it's very, very important when he says go to the dentist, at least one time every 6 months or thereabout, whatever, that you guys take these things very serious. A lot of people don't take their health serious until there is something bad happening. That is just, I don't know if it's just a mentality thing or is this an African thing or is this just a men's thing, you know? One of the reasons why I'm super passionate about organizing this is number one, we all are men. And there is this stigma that men don't take care of themselves until something is wrong or something wrong happening. We wait until whatever is bad matures and develops. That's when we'll start going out and going to doctors to take care of our health, you know. So I hope you guys are going to take things away from this. This meeting is recorded. I'm going to upload it to YouTube and share to the group. I hope you guys are taking something out from this. We are not just gathering here just because of gathering sake. So take care of your health, take care of your oral health. Um, he has offered he has offered all the recommendations. So it's now left for you to play. Agoziem, do you have something to say?
Definitely yes. Um, First of all, let me commend you, Mr. John, for all you've been doing. It's not an easy thing. It's not an easy task. You always place it upon yourself to make sure that this health talk is being organized very well. And let me also extend my appreciation to Ozioma and Leonard. Omo, this topic today was just an eye opener. So many things we disregard. So many things we just say, is it not this thing? But they are very, very important. One thing I take home in all the discussed today, the most important thing I take home is how if we don't take care of our if we don't take care of our dental health, how it's going to affect both our sugar level and our BP. It's very important. Before I didn't know that it's have anything to do. It have no. I thought it have no correlation as to regards. But today's lecture is an opener. So, Mr. Ozioma and Mr. Donald, I thank you so much. And I thank you, Mr. John, for organizing this. And I'm thanking all DOBA owners that are present or people that are not present for one reason or the other. Thank you, everybody, for being part of this. And it's quite unfortunate that I'm not going to be part of the game because I have a task I'm doing at our EBF meeting now. So I will not be part of the game. But this lecture is an eye-opener. Thank you, everybody, for being here. And the speakers, I appreciate you people very much. Thank you so much.
Thank you, President. All right, so we have 21 people right now, and we are going to go ahead and start the game. Please get ready for the game. I am starting it right now. All right, guys. I want to hit 20. Let's go ahead and hit 20. One more person. Let's go ahead. One more person.
Hello, John. Hello, John. I
Yeah.
cannot log on. I'm struggling to log on.
Why?
I
Why?
can't log on.
What's going on?
No, I'm just clicking on the link. It's not even connecting. Even with my phone, with the other of my phone, the thing is not connecting. So I don't know what's wrong. I'm trying to connect with the link and every other thing. I don't know if there are people that is still struggling with me to connect
Is there anybody else struggling to connect?
I'm struggling to connect, honestly. Even with the link.